NHA CCMA exam prep questions. Question 1. Which of the following represents an example of positive, therapeutic nonverbal communication? Option A. Crossing arms tightly over the chest while listening. Option B. Maintaining appropriate eye contact and nodding in agreement. Option C. Looking at the clock or checking a smartphone frequently. Option D. Turning your back to the patient while they ask a question. The correct answer is option B. Maintaining appropriate eye contact and nodding in agreement. Maintaining eye contact and affirming nods convey attentiveness, respect, and empathy. Crossed arms signal defensiveness or discomfort, and checking a clock communicates disinterest. Nonverbal cues often carry more impact than verbal messages in clinical communication. Question 2. When communicating clinical details about a patient's condition to another healthcare provider, which structured framework is commonly used? Option A. SPAR, situation, background, assessment, recommendation. Option B. HIPAA guidelines. Option C. SOAP notes formatting. Option D. OSHA safety data sheets. The correct answer is option A. SPAR, situation, background, assessment, recommendation. SPAR is a standardized communication tool used in handoffs and clinical consultations to ensure all essential information is conveyed efficiently and in a logical order. It reduces communication errors and is widely used across healthcare settings, including during transfers and urgent calls. Question 3. A medical assistant is taking an oral temperature using an electronic thermometer. Where should the probe be placed in the patient's mouth? Option A. On top of the tongue near the front teeth. Option B. Under the tongue in the posterior sublingual pocket. Option C. Along the side of the cheek opposite the molars. Option D. Directly underneath the frenulum near the front gum line. The correct answer is option B. Under the tongue in the posterior sublingual pocket. The posterior sublingual pocket, located at the base of the tongue near the frenulum at the back, is richly supplied by the lingual artery and provides the most accurate oral temperature reading. Placement near the front of the mouth is exposed to ambient air and yields inaccurate results. Question 4. Which of the following medical abbreviations represents a medication that should be taken 4 times a day? Option A. BID. Option B. TID. Option C. QID. Option D. PRN. The correct answer is option C. QID. QID stands for quarter in die, meaning 4 times a day. BID means twice daily and TID means 3 times daily. PRN means as needed and is not a fixed frequency. Question 5. When coordinating care for an older adult patient who is transitioning from an acute hospital stay to a skilled nursing facility, what is the primary goal? Option A. To increase out-of-pocket costs for the patient. Option B. To ensure continuity of care and safe execution of orders. Option C. To limit the number of medications the patient takes. Option D. To prevent the family from visiting the patient's room. The correct answer is option B. To ensure continuity of care and safe execution of orders. Care transitions require meticulous communication of active diagnoses, medication lists, and treatment orders to the receiving facility to prevent gaps in care, medication errors, and readmissions. Continuity of care is the central goal of all transitional care planning. Question 6. A medical assistant is managing electronic health records, EHR. Which of the following functions allows the electronic transfer of prescriptions directly to a pharmacy? Option A. Practice management billing. Option B. CPOE, computerized provider order entry. Option C. Automated clearinghouse transfer. Option D. Patient portal messaging. The correct answer is option B. CPOE, computerized provider order entry. CPOE enables providers to electronically enter and transmit medication orders, including prescriptions, directly to pharmacies or hospital dispensing systems. This reduces transcription errors and improves medication safety compared to handwritten or verbally communicated prescriptions. Question 7. A patient has insurance coverage through a primary policy and a secondary policy. To determine which policy is billed first for a child covered under both parents' plans, which rule is applied? Option A. The birthday rule. Option B. The coordination rule. Option C. The priority mandate. Option D. The age seniority rule. The correct answer is option A. The birthday rule. The birthday rule states that the insurance plan of the parent whose birthday falls earliest in the calendar year, month and day, regardless of year, is the primary insurer for dependent children covered under both parents' policies. Question 8. What is the financial term for the specific dollar amount a patient must pay out of pocket at the time of each medical office visit? Option A. Deductible. Option B. Coinsurance. Option C. Copayment. Option D. Premium. The correct answer is option C. Copayment. A copayment, copay, is a fixed dollar amount paid by the patient at the point of service for each visit or prescription. A deductible is an annual amount paid before insurance begins covering costs, and coinsurance is the percentage shared between patient and insurer after the deductible is met. Question 9. Which of the following additives is contained within a light blue top blood collection tube used for coagulation studies? Option A. Sodium heparin. Option B. EDTA. Option C. Sodium citrate. Option D. Potassium oxalate. The correct answer is option C. Sodium citrate. Light blue top tubes contain sodium citrate, a calcium-binding anticoagulant that preserves coagulation factors by preventing the clotting cascade. The blood-to-additive ratio must be 9:1 for accurate prothrombin time, patient, and APTT results. Question 10. A medical assistant is applying a cold compress to a patient's sprained ankle. How long should the compress remain on the skin to prevent tissue damage? Option A. 5 to 10 minutes. Option B. 15 to 20 minutes. Option C. 40 to 45 minutes. Option D. 60 minutes. The correct answer is option B. 15 to 20 minutes. Cold therapy should be applied for 15 to 20 minutes per session to achieve therapeutic vasoconstriction and reduce inflammation without causing tissue damage such as frostbite. Application beyond 20 to 30 minutes can lead to paradoxical vasodilation and skin injury. Question 11. A patient with a new diagnosis of type 2 diabetes mellitus tells the medical assistant, "I don't think I can afford my insulin or test strips." To which resource should the assistant refer the patient? Option A. The state's public health department. Option B. A medical social worker or patient navigator. Option C. The local emergency department. Option D. The pharmaceutical manufacturing board. The correct answer is option B. A medical social worker or patient navigator. A medical social worker or patient navigator is trained to identify financial assistance programs, pharmaceutical patient assistance programs, and community resources for patients with medication affordability challenges. The emergency department is not appropriate for financial counseling. Question 12. A medical assistant is documenting a laceration located on the anterior distal aspect of the forearm. Where is this injury located? Option A. On the front of the arm, near the wrist. Option B. On the back of the arm, near the elbow. Option C. On the side of the arm, near the armpit. Option D. On the front of the arm, near the shoulder. The correct answer is option A. On the front of the arm, near the wrist. Anterior means the front surface, and distal means farther from the point of attachment, toward the wrist. Together, anterior distal forearm refers to the front of the arm near the wrist. Proximal would indicate closer to the elbow. Question 13. A medical assistant observes that a hematoma is beginning to form rapidly during a venipuncture. What should be the assistant's immediate action? Option A. Adjust the depth of the needle to stop the bleeding. Option B. Advance the needle further into the vein. Option C. Remove the tourniquet, withdraw the needle, and apply pressure. Option D. Have the patient pump their fist to redistribute the blood. The correct answer is option C. Remove the tourniquet, withdraw the needle, and apply pressure. Hematoma formation indicates blood is leaking into surrounding tissue, likely because the needle has exited the vein. The correct response is to release the tourniquet immediately, withdraw the needle, and apply firm pressure to minimize bruising. Advancing the needle worsens the injury. Question 14. Which of the following topical wound treatments is commonly used to debride non-viable tissue from a partial thickness burn? Option A. Hydrocortisone cream. Option B. Silver sulfadiazine. Option C. Isopropyl alcohol. Option D. Hydrogen peroxide solution. The correct answer is option B. Silver sulfadiazine. Silver sulfadiazine is an antimicrobial cream widely used on partial and full thickness burns to prevent infection and assist in wound debridement. Isopropyl alcohol is cytotoxic to healing tissue and should not be used on open wounds. Question 15. When answering an incoming telephone call at a medical office, which of the following greetings is most professional? Option A. Hello, please hold. Option B. Good morning, Northside Clinic, this is Alex. How may I help you? Option C. Doctor's office, who is calling? Option D. Yeah, this is the clinic, can you wait a minute? The correct answer is option B. Good morning, Northside Clinic, this is Alex. How may I help you? A professional telephone greeting includes a salutation, the office name, the staff member's name, and an offer to assist. This establishes credibility and creates a positive first impression. Placing a caller on hold before identifying the office is rude and unprofessional. Question 16. A medical assistant performs a urine chemical screening using a reagent strip. Which of the following parameters, if positive, indicates a probable urinary tract infection? Option A. Ketones and glucose. Option B. leukocyte esterase and nitrites. Option C. bilirubin and urobilinogen. Option D. Specific gravity and pH. The correct answer is option B. Leukocyte esterase and nitrites. Leukocyte esterase indicates the presence of white blood cells, pyuria, and nitrites are produced when bacteria convert urinary nitrates, both strongly suggesting a UTI. Ketones indicate fat metabolism or fasting, and glucose suggests hyperglycemia, not infection. Question 17. A healthcare provider performs an invasive procedure on a competent patient without obtaining their signature on an informed consent form. What legal charge could apply? Option A. Battery. Option B. Negligence. Option C. Defamation. Option D. Fraud. The correct answer is option A. Battery. Battery is the intentional, unlawful touching of another person without consent. Performing an invasive procedure without informed consent constitutes battery, even if no harm results. Negligence involves a breach of duty resulting in harm, which is a different standard. Question 18. When administering eye drops, ophthalmic medication, where should the medical assistant instill the drops? Option A. Directly onto the center of the cornea. Option B. Into the conjunctival sac of the lower eyelid. Option C. At the inner canthus near the tear duct. Option D. Along the upper eyelash margin. The correct answer is option B. Into the conjunctival sac of the lower eyelid. Eye drops should be instilled into the conjunctival sac formed by gently pulling down the lower eyelid. This avoids direct corneal contact, which triggers the blink reflex and causes medication loss, and allows the medication to distribute across the eye surface. Question 19. A medical assistant accidentally sustains a needle stick injury with a contaminated needle. What is the very first action that should be taken? Option A. Notify the clinic manager or supervisor. Option B. Wash the exposed area thoroughly with soap and water. Option C. Report to the nearest emergency department. Option D. Complete an incident or exposure report form. The correct answer is option B. Wash the exposed area thoroughly with soap and water. Immediate and thorough washing of the wound with soap and water is the first priority to reduce pathogen load at the exposure site. Reporting and post-exposure prophylaxis follow after initial wound care. Delaying washing to report first increases infection risk. Question 20. A medical assistant is preparing to autoclave surgical instruments. Which of the following indicators ensures that the sterilization parameters of time, steam, and temperature were met? Option A. Autoclave tape color change. Option B. Chemical indicator strip inside the pack. Option C. The pressure gauge reading 15 psi. Option D. The water level inside the reservoir. The correct answer is option B. Chemical indicator strip inside the pack. An internal chemical indicator strip placed inside the pack is the most reliable indicator that sterilization conditions were met throughout the entire pack. External autoclave tape only confirms the pack was exposed to heat, not that internal contents were sterilized.